Hello, my name is Dr. Bruce Eimer. I'm a licensed psychologist and certified hypnotherapist here in South Florida, and I'm also a board-certified diplomate with the American Board of Professional Psychology. I've authored a number of books on the clinical applications of hypnosis for treating chronic pain, anxiety, and depression, and I also give continuing education workshops for therapists and other health professionals. I'm here today to talk with you about a natural approach to treating depression using the tool of hypnosis. I've been using hypnosis to treat people with clinical depression and other symptoms and signs of depressive disorders for many, many years. Currently, with the coronavirus epidemic and forced social discipline and self-isolation, people are experiencing great strains as a result of loneliness and the lack of contact with other people. This does tend to make people more vulnerable to developing depression if they don't already have it, and to worsening of depression if they already have it, because we're all social creatures and we all need to be connected on some level to other people. And at this time in our lives, when we're forced to restrict our social contact, we have to find other ways of keeping ourselves occupied, and that's very important. Now, I'm offering a webinar, a 2-day webinar that is coming up later this month on using hypnosis for taming depression. This webinar was organized as a result of the fact that due to coronavirus, the annual meeting of the sponsoring organization, which is the International Medical and Dental Hypnotherapy Association, had to be canceled and turned into a virtual online meeting for everyone's safety. Now, what I'd like to do today is give you a taste of what we're going to cover in this didactic and experiential workshop in a couple of weeks. You can find out more about signing up for this workshop and register for this workshop on the website of the International Medical and Dental Hypnotherapy Association, which is www.imdha.com. Okay, well, first of all, the first thing that I'm going to be teaching is a useful way of thinking about depression that is an alternative to the medical model. Now, the medical model and the model that is promoted and published by the American Psychiatric Association is important, because as psychologists and hypnotherapists, we need to make sure that our clients are appropriately worked up medically and psychiatrically if needed, and treated medically and psychiatrically if necessary. I'm not in this workshop going to go into detail on the biological and biochemical model of depression, but there certainly is a great deal of validity to that, and it exists. So there are people that need to be on antidepressant medication. This workshop is not about that, but as a psychologist and hypnotherapist, it is always important to make sure to work in tandem with your client's treating physician and have criteria for referring a client with depression to a qualified licensed psychiatrist. With that said, what I want to talk about today and talk about in this upcoming webinar is the idea that people who are depressed experience life as repeatedly knocking them down to the point where they begin to feel helpless and, unfortunately, worthless. And there are people that don't have the ego strength or the motivation to want to help themselves to get back up after they've been knocked down so many times. Those folks are serious candidates for medical and psychiatric treatment. But there are many folks, since depression comes in so many different guises and forms, there are many folks that want to work on getting better and need help in the form of structured, competent counseling. And as a psychologist that has been doing psychotherapy since 1986, I've learned over 30 years ago that the tool of hypnosis is remarkable in its versatility and in its power when used appropriately as part of a psychotherapy program. Now, it's important to understand when one wants to intervene on a psychological level that all feelings are calls to action by the mind and the body. Basically, a feeling, whether it's anxiety or sadness, fear, depression, is your unconscious mind telling you that you need to do something. Just as pain is a signal from the body that there's something wrong that needs to be addressed. Okay. Now, contrary to what people implicitly think, that's many people, that you have to fight depression, that you have to kill depressive thoughts, that you have to get rid of them. My thinking on the matter, which is validated by research and some really good books that have been written over the years, my idea is that it is important to listen to your depression and to work on understanding what your depression is trying to tell you. Because in the animal kingdom, there are times when, in their own species-specific ways, animals get depressed. If you have a dog, especially, you'll know from your experience that there are times when your dog just seems like listless, kind of out of it. If you look in his or her eyes, you just kind of see this feeling of looking like they don't want to do anything. They feel like dejected. And dogs are seriously absorbers of the way that their masters feel. So they're very much affected by our moods. And so a lot of times, like a young child, if you're feeling down and you don't reassure your doggy, your dog will start to catch and absorb that feeling and feel down themselves. And, without trying to get into what a dog is thinking in human terms, the dog might feel dejected or feel that he or she did something wrong. Well, with depression, when people get depressed, they get down on themselves and think that they've done something wrong, that they've done their whole life wrong, and that they're wrong. And it is because when you get to that point where you're clinically depressed, whether it's a little depression or a lot of depression, you've ignored a lot of the signs along the way from your mind and your body that are telling you to slow down, to take a look at yourself and what you've been doing, and to reevaluate things. And that's very, very important. Now, certainly people that are depressed, that think in very, very globalistic, negative terms, that see themselves, the world, their future in totally dark, bleak terms, need to be helped to re-examine and change their thinking. But unfortunately, many approaches that have been subjected to empirical tests, cognitive therapy type of approaches over the years, have been misinterpreted as promoting the idea that people need to just accept that their thinking is bad and that they're depressed because of bad thinking, and they need to replace their thinking or correct their thinking with better thinking. And that's a very stark kind of psychoeducational approach that ignores the importance of the human factor, where you need to work with a client to encourage him or her to really listen to themselves with understanding and respect, and the desire to know more about themselves in order to feel better and get better. Now, let's take a moment to talk about what depression actually is. Well, it's not the enemy. It's your body and your unconscious mind telling you that there's something gravely wrong with your life that you need to re-examine. And when people get depressed, they need some kind of guidance, they need some kind of help to help them to lead them out of the depressed land, if you will. And that's when people need to turn to a therapist for help, or depending on their level of sophistication and ego strength, they can read a good self-help book and help themselves. But that's often not possible, and then they need a good therapist, which often, the therapy can often be very profitably augmented and empowered by the use of clinical hypnosis. Now, in working with my clients, after the initial assessment phase and the building rapport phase and the diagnostic phase, I create an individualized treatment plan that incorporates the use of the tool of hypnosis, and I make sure that I have my clients' agreement that the treatment plan is viable and desirable. And some of the tools that I found to be indispensable in treating pretty much everyone that's depressed is, number one, helping them find meaning in their life and find a purpose. Because everybody basically has a purpose, and often we don't know what it is, and we need sometimes to sit down and introspect, go inside, and find out what that purpose is. I incorporate inner work using hypnosis and guided meditations that address various factors that seriously affect our emotional functioning. One of the approaches that I use is an approach that has been developed and refined through the organization called HeartMath, and it involves learning through inner work to get in touch with your heart mind as opposed to your brain mind, through the practice of gratitude and appreciation through guided meditations and breathing exercises. We're going to do a brief exercise like that here today to give you a taste of what we're going to cover in detail in the 2-day webinar that's coming up in a couple of weeks. I've also developed a model for doing hypnotherapy that I call the AWARE model. And the AWARE model is kind of like a phase or stage model of doing therapy, whether it's in one session or across multiple sessions. And it incorporates the elements of acceptance and commitment, watching without judging, adjusting how you respond to yourself and others, self-talk, other people's responses, and so forth, your expectations about other people and yourself, releasing unneeded emotional burdens that wear you down, and envisioning what's next. Most people that are clinically depressed can't envision a viable future. Hey, Leo. As I said, inner work is a big part of the therapy that I use for treating depression. People that are depressed need to be helped to focus on others, help others, as opposed to focusing on their own dejection. Pet therapy is a very effective modality for treating depression, and if you have a pet like I do, like my German Shepherd dog, they can be great, as mine is, for helping to avoid a depressive episode or get out of a depressive episode. And of course, in this webinar, we're going to cover how to be your own therapist. Now, I'm writing a book which is entitled Tame Your Depression. It should be out in a couple of months, and everybody that takes my webinar will get a free copy of the book, Tame Your Depression. It will be published eventually on CreateSpace with Amazon.com. Now, another thing that I want to mention is that for years I've been intrigued as both a therapist and a hypnotherapist with the whole idea of using people's conceptions of time to help them to heal. I have been involved in doing hypnotic regression therapy for years. I authored a book on hypnotic regression therapy with my friend and colleague Roy Hunter, which is called Hypnotic Regression Therapy. And I've been thinking over the years and developing a form of therapy which I call time sense therapy. And I've developed this approach because I've discovered through my own experiences and working with clients that there are many times when I'm dissatisfied with the way I handled myself in a particular situation, and I need to, in my mind, go over it in my mind and redo how I handle the situation so that I can handle it better next time. One of the experiences that I had early in my life was being involved in a terrible motor vehicle accident, and I thought I was going to die, and as the other vehicle was broadsiding my vehicle, everything began to go in very slow motion, and I managed in slow motion to see the tree coming as my Jeep was being pushed into a large oak tree, and in slow motion managed to steer away from the tree. Now, what I want to mention to you is that I've learned also through my experience in doing martial arts that it helps to practice new techniques in slow motion, which you can then speed up in real life. And then it came to my brain that what about if we can, in a situation live where something is occurring that we have to respond to immediately, if we can change our sense of time so that we can imagine that we are responding, even if there's only a second to respond, in slow motion, so we can spread out the amount of time that we have to respond in a helpful and life-saving manner. And when working with people with anxiety and depression, I found that, especially through the use of the hypnosis tool, which allows us to bend reality in a therapeutic manner, that one can look at specific episodes in one's life recent experiences, for example, that are continuing to be troubling and contributing to one's sense of inadequacy, and one can redo one's experience of those episodes by changing one's sense of time as one reviews and relives those experiences in the safety of a good, competent therapist's presence. Okay. So, time sense therapy is something that we're going to cover in detail in this webinar, and we're going to have a lot of time, 2 days, to understand it intellectually and didactically, and then experience different time sense therapy techniques, such as the time deceleration technique and the time acceleration technique, through experiential exercises and practice. Last thing about time sense therapy for now is the idea that because people who are depressed view their future as non-existent or dark or foreshortened, the use of time sense therapy techniques can help them to develop and envision a real future that's positive and realistic. Now, the last thing that I'd like to do is I'd like to just guide you who are watching this through a very deceptively powerful HeartMath exercise, which actually in the HeartMath literature goes by different names. The name is unimportant right now. What's important is the actual steps in this guided meditation. So I'd like to invite you, if you'd like to participate, to take a few slow, deep breaths and to close your eyes and to focus on your breathing and to imagine that you're breathing through your heart area. Breathing in, slowly imagining your breath as you inhale going through your heart area, and then as you exhale also coming up through your heart area as your breath is exhaled, as you blow stress away as you exhale. Breathing in again through your heart, exhaling, imagining that the breath is flowing through your heart. Inhaling, exhaling. And you may want to just hold your hand over your heart like you're saying the Pledge of Allegiance as a reminder, as a tactual cue. And as you continue to breathe, your mind will wander. When your mind wanders, it's simply a signal to bring your attention back to your breathing through your heart. I'd like to invite you to think of someone or something that you really, really appreciate and possibly love. It could be a pet, like my boy Leo here. It could be a child, a grandchild, a spouse, a parent, somebody whom you really appreciate. And just feel, as you focus on such a person or entity, an inner smile coming up. As you continue to breathe, your feeling of that person or that pet through your heart. Don't intellectualize, feel with your heart. And after a little while, after you've done this for a minute or two, this will soften you. And when you're ready, you can open your eyes, take a deep breath, bring yourself back to fully alert, and just breathe normally. And notice how much more calm and how much more peaceful and how much more upbeat you feel, having experienced gratitude and blessing as you focused. Stop it, Leo. Leave the pillow alone, bud. Up, up, up. As you focused on this person or pet that you feel grateful for, and that you feel grateful, more grateful and blessed to be here and to be alive. Okay, well, I really appreciate your watching this video. I invite all of you to register for my webinar on hypnosis for taming depression, which will be given online virtually through the International Medical and Dental Hypnotherapy Association. Online, go to their website, www.imdha.com, to register. And as well, have a visit to my website, which is www.bruceeimer, BRUCEEIMER.com. Okay, well, thank you for watching and listening. Stay safe, stay smart, stay busy, and stay well.